Washington, D.C. In a high-profile Thursday night event at the White House, President Donald Trump unveiled TrumpRx.gov, a new federal government website designed to offer millions of Americans access to deeply discounted prescription drugs. The launch marks the most visible rollout yet of an ambitious policy initiative the administration has pursued for more than a year, one framed by its backers as a historic step toward lowering what many consider exorbitant U.S. drug prices. With the site now operational, patients with prescriptions can visit the platform to view steeply reduced prices on dozens of brand-name medicines and obtain manufacturer-specific coupons or links to purchase drugs directly at those prices. The initiative has drawn intense attention from patients, pharmaceutical companies, political allies, and critics alike, all watching to see whether the rollout delivers tangible cost savings for everyday Americans. A most favored nation pricing strategy. At the heart of TrumpRx.gov is the administration's use of so-called most favored nation, MFN, pricing deals with major pharmaceutical companies. Under these agreements, drug makers commit to providing U.S. patients with prices that match the lowest cost paid in other developed nations, a departure from long-standing U.S. practice, where list prices for many medications are significantly higher than abroad. The White House fact sheet released on the day of the launch notes that the first wave of deals involves manufacturers such as AstraZeneca, Eli Lilly, EMD Serono, Novo Nordisk, and Pfizer. These commitments have been months in the making and stem from a May 2025 executive order directing the administration to bring American drug prices in line with the lowest international benchmarks. President Trump characterized the approach as a landmark achievement. Americans have long been paying the highest drug prices anywhere in the world, he said, adding that the new pricing strategy would end an era in which U.S. patients subsidize lower costs in foreign markets. We're taking the lowest price anywhere in the world. That's the price you're going to be paying, he emphasized at the announcement. Pricing reductions and patient impact. According to the White House's fact sheet, more than 40 of the most commonly used and most expensive branded medicines in the United States will be available under the reduced pricing structure. These range from treatments for chronic diseases to fertility medications and inhalers. Examples of significant price cuts. Ozempic and Wegovy, GLP-1 drugs used for diabetes and obesity monthly prices, previously above $1,000 for some dosages, are now averaging between $199 and $350 Zepbound, reduced from $1,088 to approximately $299 to $346, depending on dose. Fertility drugs like Gonal-F dropped from retail prices above $300 to as low as $168 per pen. Inhalers for COPD and asthma, Bevespi from $458 to $51, Air Super from $504 to $201 to Insulin Lispro, available for as little as $25 per month. The fact sheet also highlighted dramatic price cuts for other drugs treating conditions like dermatitis, osteoporosis, and heart disease. The discounts advertised on TrumpRx.gov represent cost reductions of up to 90% or more compared with original list prices. How the website works. Although the launch has been billed in political terms as a major achievement, TrumpRx.gov is not a direct retail pharmacy. Instead, the government site functions as a centralized portal that lists discounted medications, displays the manufacturer-negotiated prices, and generates coupons or redirects to external pharmacies or manufacturer sales channels from which consumers can make purchases. According to officials, consumers can print a coupon or save a digital version on a smartphone and present it at participating pharmacies for checkout discounts. For specialty drugs, the portal may direct patients to mail-order pharmacies capable of delivering medications directly to their homes. Political context and broader affordability narrative. The Trump administration's push to lower drug costs has been a centerpiece of its domestic policy rhetoric. In July 2025, Trump issued letters to major pharmaceutical leaders demanding that U.S. prices be aligned with lower international benchmarks, and subsequently announced 16 pricing deals with drug makers. These agreements form the backbone of the TrumpRx.gov launch. President Trump has also tied the policy to broader healthcare proposals, including his Great Healthcare Plan, which calls for codifying the MFN pricing strategy, reducing insurance premiums, and enhancing transparency for consumers. Supporters within the Republican Party have hailed the initiative as a bold break from decades of drug pricing dynamics that left Americans paying far more than residents of comparable nations, a sentiment echoed by Trump at public rallies and campaign events. Reactions: praise and skepticism. Pharmaceutical industry and allies. Participating drug makers have generally expressed support for the initiative, Leaders at companies like Pfizer and Novo Nordisk touted the potential for expanded consumer reach through the platform and emphasized their willingness to engage with government-mediated pricing strategies. Dr. Mehmet Oz, administrator of the Centers for Medicare and Medicaid Services, joined Trump at the launch event and spoke optimistically about the initiative's potential to improve public health by increasing access to essential medications. Critics and health policy experts. Despite the positive framing from the White House, health policy experts and consumer advocates have voiced reservations about the real-world impact of TrumpRx.gov. Many argue that the discounts, while significant for some patients, may be less meaningful for individuals with robust insurance plans whose coverage already drives down out-of-pocket costs. Some critics also question whether the initiative's focus on cash pay pricing truly addresses the larger structural factors contributing to high drug costs across the U.S. healthcare system, including insurer practices and the role of pharmacy benefit managers. These debates are likely to shape ongoing public and legislative scrutiny. Looking ahead, implementation and expansion. The White House has signaled that TrumpRx.gov will continue to expand both in terms of participating manufacturers and the number of discounted drugs available. Additional drugs from companies that recently signed MFN pricing deals are slated to be added to the portal in coming months. As the 2026 midterm elections approach, many political observers expect TrumpRx.gov to feature prominently in debates over affordability and health policy. Whether the platform delivers tangible savings to a broad swath of Americans remains a central question, and one that patients, lawmakers, and industry stakeholders will be parsing in the months ahead. The launch of TrumpRx.gov represents a bold, highly publicized effort by the Trump administration to tackle one of the most enduringly unpopular aspects of the U.S. healthcare system, the high cost of prescription medicines. With dramatic price reductions on dozens of drugs, a direct-to-consumer portal, and a strategy grounded in international price comparisons, the initiative could alter how many Americans access and pay for medications. Yet the true measure of its impact will unfold over time, shaped by how effectively the program delivers savings to patients and how critics and supporters alike respond to its evolving role in American healthcare.